So the medical homes at UVM have had a huge cultural shift over the past, I'd say, 6 to 9 months. The governor had come to the hospital and said, what are you doing to help address the opiate crisis in Vermont and treatment for addiction? And at the time, we really weren't doing very much. We had a few pockets of individuals that were doing some treatment with Suboxone, which is a medication used to treat people that that are opiate dependent, so physically dependent on pain medications. And outside of that, there was not much treatment available in the UVM system. And so what has transpired over about the last 8 to 9 months is that the Day 1 expansion program was up and running in February. So they are now acting as a bridge from patients that are initially treated at the higher level of care, the Chittenden Center, the hub. They transition now through the Day 1 expansion program into the medical homes. But what we needed, in order to take patients into the medical homes, we needed providers trained to do this kind of work. So we've had, I think, close to 40 physicians now receive their DEA waiver to prescribe Suboxone. They have each agreed to take, for starters, 5 patients into their practices. These patients are already known to their practice, maybe not to the individual doctor, but to their practice. And we've been slowly taking patients out of the hub, out of the Chittenden Center. So the CDC sent out new guidelines around opiate prescribing in April. And that has also been a great way to start the conversation with providers about opiate prescribing and safe opiate prescribing and what medications to prescribe opiates with and not with, and what are the maximum doses, and what kind of screening should you do before you prescribe opiates. And that's the other piece of this, is really trying to have a cultural shift around opiate prescribing. This has been a great example of community collaboration, because when the governor first came to the hospital and said, you guys need to do this work, we invited a lot of community partners to the table to help us figure out what needed to happen. And so folks from the Chittenden Center were there, TJ Donovan was there, the Department of Health was there, the Community Health Center. There were many stakeholders at the table. And we, as a group, well, everyone started out in their own silos of trying to figure out how it affected them, or what their piece was or wasn't, or what people were doing or not doing. And we had a patient come speak, and he told his story, and it really worked to kind of reshift everyone's focus to what we're talking about, who we're talking about. We're talking about our kids friends, our neighbors, their kids. This really affects everybody. There is no socioeconomic factors here. It really affects everyone. So this has been a great kind of community collaboration, and definitely affects our entire community.